part 2 of fact-checking Chat GPT from a labor and delivery nurse. Do something C-section related. What are the steps of a C-section? I'm not even gonna do cesarean, I'm just gonna do C-section. C-section is a surgical procedure in which a baby is delivered through an incision in the mother's abdomen and uterus. Here are the general steps. Anesthesia, which is usually given through an epidural or spinal block. That's true. And then it says, number 2, incision. The surgeon makes an incision in the mother's abdomen and then a second incision in the uterus. That is true. Number 3, delivery. The baby is gently delivered through the incision. I will say I don't know if it's very gentle, but it is effective. Number 4, placenta removal. The placenta is removed from the uterus. And number 5, closing incisions. The surgeon then closes the incisions, typically using stitches or staples. Most of the time it is sutures, so stitches, not staples. And then it says, important to note that C-sections are major surgeries and are typically only performed when necessary for the safety of the mother and or baby, which is all very true. Thumbs up to that one. Okay, the next question I'm gonna do is, how much should I bleed postpartum? It says postpartum bleeding, also known as lochia, which is so true, oh my gosh, is a normal and expected part of the recovery process after childbirth. The amount and duration of bleeding can vary from woman to woman and can also depend on the type of delivery, so vaginal or C-section. This is very true because during a C-section, we usually manually take out a lot of the blood and clots, whereas if you're having a vaginal delivery, that will just come out on its own. It says, in general, it's normal to have heavy bleeding similar to a heavy period in the first few days after delivery. This bleeding will then gradually decrease over the course of several weeks. Yes, usually we say 6 to 8 weeks is normal for the bleeding to continue. And then it says something about excessive bleeding. If it's persistent, accompanied by other symptoms, then you should go to your healthcare provider immediately, which is so, I am mind blown, you guys. This information is actually very accurate. I do want to say, as fun as this is, and honestly as accurate as it is, as surprisingly as I can say that, I would definitely talk to your healthcare provider first, okay? Do not use ChatGPT for any of this stuff. It is not necessarily safe. This is just something fun that we can do. If you guys want to ask any other questions that I can fact check for you, leave them in the comments below.